Well, most of the country is still seeing intense activity, and we do have a lot of hot spots on the East Coast. Things are starting to ease up a little bit on the western states, and that is where influenza season began a little bit earlier. But that said, it is very famous to say that influenza is unpredictable. We're not out of the woods. The western states could see increased activity in the future, and it's not too late to get a flu vaccine if you haven't already gotten one this year. It's a major threat right now. 1 out of 10 people dying the past week died from pneumonia or influenza. We are seeing a year where it's quite challenging to handle the flu. Sadly, 53 children have died from influenza so far this season, and we expect that number to go up. We're seeing increases in total deaths from pneumonia and influenza, primarily in adults. So unfortunately, hospitalizations are increasing, as are deaths. This year, we're seeing the H3N2 influenza virus dominate. Years where that strain dominates tend to be more severe. We've also seen that the vaccine against the H3N2 viruses tends to be less effective than vaccine against other strains. Those two combinations probably account for some of the severity that we're seeing. We don't know if the season has peaked yet. Influenza seasons can last between 11 to 20 weeks, and we're just at week 10. So I expect that we'll have several more weeks before we see the end of the season. Unfortunately, we are aware of spot shortages of antiviral medicines in different places around the country where influenza activity is high. But speaking with the manufacturers, we know that there is supply available of antiviral medicines. We're encouraging pharmacies to have more antiviral medicine available on the shelf, and we unfortunately ask parents and others to be persistent. Call around if you make sure the pharmacy has the product before you take a trip there. The flu is usually associated with fever, and colds usually aren't. The flu is usually associated with pretty noticeable aches around the body. It can have headache, muscle aches, and colds usually are not. And the flu is associated with cough a bit more than colds are. There can be sore throats in either of them, but a little bit more in flu than in colds. So those are some things to look for, and we have a real nice checklist, I think, on the web that you all might want to use.